So sickle cells clump together and accumulate in all body systems, so we need to monitor for complications of sickle cell crisis. So when there's vaso-occlusion of the small vessels in the brain, that leads to a stroke, and that causes findings like facial droop, slurred speech, and one-sided weakness. So when there's vaso-occlusion of the small vessels of the lungs, that causes acute chest syndrome, and these findings are really similar to pneumonia. So we see high fever, cough, and chest pain. When sickle cells clump up and cause blood to pool within that spleen, that's called acute splenic sequestration. And when there's pooling of blood in the spleen, that causes sudden splenic enlargement. And because there's so much blood in that spleen, it's not circulating the rest of the body, and it causes signs of hypovolemic shock, like increased heart rate and decreased blood pressure. When a viral illness like parvovirus causes decreased red blood cell production or increased red blood cell destruction, that is called aplastic crisis, and that leads to a severe drop in red blood cells and profound anemia. If you see any of these findings in a sickle cell client, you need to report them immediately. So for our next quick check, take a moment to answer these questions. So how does a nurse manage pain for vaso-occlusive crisis? We give high-dose analgesics to help that severe pain, and we give warm compresses because that helps vasodilate, which helps decrease that ischemic pain. What are signs of acute chest syndrome? Well, remember, those signs are similar to pneumonia, things like fever, cough, and chest pain.